Hello and welcome to the live broadcast of the launch of Vector Awareness Week via the National Television Network NTN and the Government of St. Lucia's Facebook page. I am Fernelle Neptune. August 3rd to the 9th is observed as Vector Awareness Week, and of course the Ministry of Health is focused on educating the public on reducing the risk of vector-borne illnesses. Today we have a few officials within the Ministry of Health and also the St. Lucia Solid Waste Management Authority who will provide us with some valuable information on vector and vector control. Welcome. First, we have with us the Medical Officer of Health, Dr. Glensford Joseph. Also, we have the National Epidemiologist, Dr. Francois. We have the Environmental Health Officer for Vector Control, Charletta Charles, and also the Information and Communications Manager for the St. Lucia Solid Waste Management Authority, Emlyn. Welcome.
Thank you.
First, we will have Dr. Glensford Joseph, who will give us an overview of Vector Awareness Week.
Thank you, Ms. Neptune. The Ministry of Health and Wellness is launching its 2020 Vector Awareness Week from August the 3rd through the 8th, 2020. While we observe August the 3rd through the 8th as Vector Awareness Week, vector control should be an everyday business as well. As individuals, we can contribute to the reduction of vector-borne diseases. Presently, we are in the May-December rainy season, where May and December marks the transition from the wet to the dry season. And in the June the 1st to November the 30th, 2020, Atlantic hurricane season. Historically, the Ministry of Health and Wellness observed an increase of dengue and leptospirosis during the rainy season. The mosquito Aedes aegypti, that is responsible for the transmission of diseases like dengue, Zika, chikungunya, generally lives in the stagnant water in and around our homes and in the communities. Our behavior contributes significantly to the breeding of mosquitoes and rodents in our environment. As a result, we have an opportunity to contribute to vector control measures with little or no cost. Hence, the 2020 Vector Awareness theme, Our Action, Our Community, Our Health, signals the need for us to have more control of vector breathing through our collective actions to reduce the impact of vector-borne diseases on the individual, the community, and the country as a whole. This year, due to the COVID-19 pandemic, the ministry has modified its approach in mobilizing community participation to ensure reduction in the indices of vector-borne diseases in St. Lucia. As a result, this virtual platform has become a very important tool in bringing about the awareness to vector control and vector-borne diseases in St. Lucia. This presentation that we are having today marks one in a series of media appearances to inform, educate, and empower the public on how to stop the spread of vector-borne diseases. The ministry will be sending Zimber blast messages to government workers. They will also be utilizing the email of corporate St. Lucia, where messages as to how we can best control vector-borne diseases can be shared. We also will be utilizing some short messages that will be inserted in our, that is, the Ministry of Health Communication Network as a call-wait message to inform persons of vectors and vector-borne diseases as they make the call and await direction to the relevant departments. PSAs will be used at various levels in the schools, on the airwaves, in the community wellness centers, to further highlight the need for us to have significant control on vector and vector-borne diseases. The loudspeakers will also be a very important tool, and this will be explained further to share the message. The Ministry of Health and Wellness, through the Environmental Health Department, will intensify its vector control measures. The ministry will also continue to collaborate with other stakeholders like the St. Lucia Solid Waste Authority to ensure reduction of vector-borne diseases in St. Lucia. At this point, I must say that the Ministry of Health and Wellness will continue to monitor vectors and vector-borne diseases and provide you with an update as the condition or situation changes. Moving forward on our panel, the rest of our panelists will provide you with other information as it relates to vector-borne diseases, dengue, vector control measures, and how our St. Lucia Solid Waste Management Authority contributes towards the reduction of vector-borne diseases in St. Lucia. Thank you.
Thank you very much, Dr. Joseph, for providing us with this information as it relates to the ways in which the Ministry of Health will be educating St. Lucians on reducing the risk of vector-borne illnesses. Thank you so much. Right now, we have Dr. Michel Francois, who will be giving us an epidemiology of dengue. And of course, dengue is one of the common vector-borne illnesses in St. Lucia.
Thank you, Ms. Neptune, and good morning all. Dengue fever is one of the most prevalent arboviral infections worldwide. It is, as its name indicates, a viral illness which is caused by the dengue virus, and it's usually transmitted by the female mosquitoes, mainly the Aedes aegypti, and to a lesser extent the Aedes albopictus. It is also responsible for the spread of chikungunya, yellow fever, and Zika. These are all illnesses that we are familiar with, that we have experienced in St. Lucia. The mosquitoes, as previously indicated, they live among humans. They live in fresh water. They live in our homes, and they are daytime feeders. So when you get a bite from a mosquito, you usually look at the mosquito and see these white lines on the legs, and during the day it tends to be the Aedes aegypti mosquito. Dengue is found throughout the tropics, and it's mainly affected by rainfalls and humidity. So you find in areas where you have high levels of rainfall, you tend to get more breeding of the mosquitoes, as well as in places that have, with rapid urbanization, places that have developed suddenly and do not have the measures in place to control waste disposal, etc. There are 4 distinct types of dengue, type 1, 2, 3, and 4. These various types of dengue have been seen within the region. Having an infection with one type of dengue provides lifelong immunity to that specific serotype. However, if you contract dengue the second time, there is the possibility that you tend to develop a more intense or severe form of dengue. So having experienced dengue in the past and having a second strain would predispose you to having a more severe dengue illness. So as indicated, it is transmitted primarily through the bite of the female mosquitoes, primarily the Aedes aegypti. The dengue viral infection has an incubation period of about 4 to 10 days after the bite of the infected mosquito. About 75% of these dengue infections are either asymptomatic or they manifest as very mild illnesses with fever and non-specific signs and symptoms. And we will go into the clinical picture a little later in our presentation. Non-severe dengue, as I said, produces a non-specific illness, and it affects infants, young persons, adults, all extremes of life. And the symptoms usually last anywhere between 2 and 7 days. Our regional authorities have warned that for 2020, we are to expect outbreaks of dengue. And according to the French authorities, the French Caribbean is currently experiencing outbreaks of dengue, with predominantly types 1, 2, and 3 in circulation. And of course, this is of concern to us because we know of the level of travel between St. Lucia and our French territories. So we have to keep an eye on this and monitor very closely what is happening in St. Lucia, as our neighbors have reported cases of or outbreaks of dengue fever. In St. Lucia, we monitor our dengue situation mainly through undifferentiated fever. So this is fever with persons present with fever with non-specific signs and symptoms. So it could be fever with eye ache or sensitivity to light, with joint pains or muscle pains. So we monitor that on a weekly basis, and that information is sent from all our public health facilities to the epidemiology unit. And through the years, what we have found that these increases in dengue infections always coincide with our undifferentiated fever, and usually within our rainy season when we have an increase in breeding because of the rains and because of collection of water in all sorts of receptacles, as small as stoppers, and the smallest receptacles can breed dengue fever. In St. Lucia to date, we have recorded an increase in the number of cases compared to last year. We are currently at 41 cases, and we have isolated a serotype 3 in St. Lucia to date. We continue to monitor and we continue to test through the assistance of the Caribbean Public Health Agency, where serotyping is done. We've also noted for this year to date that the age group most affected would be the 5 to 9. So our kids are being affected, followed by the age group 10 to 14 years. But there has not been any difference in the sexes. The areas that we have noted with highest prevalence, and that is not just numbers, but based on the population of these areas, we have noted that the areas of Radwe, Mon Road, Castries City in general, Millet, Old Victoria Road, Monier, and Tuapito areas have the highest prevalence of cases of dengue reported to the Ministry of Health. So although I have highlighted some areas of concern, we continue to work with all areas because persons are not stagnant, the mosquito itself is not stagnant, and therefore it is possible for other places based on their practices to become targets and start recording higher cases of dengue infection. So we will continue as a ministry and with our stakeholders to monitor what is happening with dengue fever in St. Lucia and put measures in place, continue working with the public to ensure that the numbers are under control and we do not have a massive outbreak of dengue in St. Lucia. Thank you.
Thank you so much, Dr. Francois. Of course, you mentioned that in St. Lucia we have realized that there is an increase in the cases. So it is definitely something that we in St. Lucia need to take note of and take the necessary precaution. Thank you. So before we go into vector control measures as to what persons can do to actually prevent the mosquito breeding and also the rats, we will have Dr. Joseph who will give us a clinical manifestation of a dengue.
Thank you, Ms. Neptune. As Dr. Francois would have indicated, some of the clinical presentations of dengue, it is important to note, yes, we would have had 4 different types of dengue, and as pointed out, we have circulating type 3 dengue presently. Why that is important is that once you have been infected with dengue once, and you have infection with another strain, you're likely to have a more severe form of the illness. It is important to note at this time that while we talk of dengue, vector-borne diseases, and how best we can prevent the spread of these illnesses, we need to be cognizant that we are in the midst of a COVID-19 pandemic. As such, it means that as the public, general public, we need to pay heed not only to the signs and symptoms of dengue fever, but also COVID-19, as it will tailor the way we respond and present ourselves to the healthcare professionals. Like COVID-19, dengue affects all age groups, as pointed out, especially the younger population, the infants, and for persons who have comorbid illnesses, that is, persons with hypertension, diabetes, heart diseases. And as such, it is important for us to realize that all of us are at risk for this infection, and while we have diabetes, hypertension, we are at greater risk to develop the more severe form of the illness. Dengue and COVID-19 have some similarities, yet differences. They both can have infected persons without symptoms, that is, you're asymptomatic, while some presents with a mild form of both diseases. With, for instance, dengue, you may have fever, headache, muscle ache, joint pains, a rash, among others. And it is important to know that in the late stage or stages of dengue, you may very well have a cough. For a more severe form of dengue, as pointed out, persons may very well have abdominal pain, they have persistent vomiting, and some may have bleeding from the gums, among other places, and a change in the level of consciousness. As pointed out earlier, the infants are at risk, persons with comorbid illnesses, the elderly, and if you have had dengue previously, you're likely to have a more severe form with another or a second infection. When we look at COVID-19, which is currently, yes, circulating in the Caribbean, and St. Lucia is no exception, we have learned again that persons can be infected with the COVID virus and walking around without signs and symptoms, while others may have mild form of the illness with fever, chills, a cough. Some may develop shortness of breath, fatigue, muscle ache, a loss of smell, a loss of taste, a loss of appetite, sore throat. So you recognize that when you look at dengue and COVID-19, there are similarities, yet differences. They're transmitted differently, where dengue is by the bite of an infected mosquito, as pointed out, the Aedes aegypti, while COVID-19 transmitted generally through respiratory droplets, and as such, with this information, it would guide us in the way we have to protect ourselves against the two illnesses. As pointed out, both are in St. Lucia, and you can have what is called the coexistence in country and the co-infection, where one person is impacted by both the COVID and dengue, as observed in other countries. As a result, it is important for us to take all measures to prevent the transmission or spread of dengue and COVID-19. If you think, based on your symptoms, that you have either dengue or COVID-19, it is important that you take the necessary steps, the necessary measures, protecting against the transmission of COVID-19 while you seek medical advice. And this is important because while you can have both illnesses, knowing that COVID-19 is transmitted mainly by the respiratory route, it is important that you continue to wear your mask, not only at all times in the general public, or once you're getting within 6 feet of others in your environment. But when you're presenting to the healthcare facility for treatment, it is important that you wear your mask and use your hand sanitizers while the doctors, nurses are going to assess you to determine which of the two illnesses you're having, and this would guide our management. As you realize, having the two circulating in St. Lucia poses a challenge to our healthcare system, to the individual, and to the community, because they have similarities, yet they have differences that warrant different treatment. At this time, with the information provided as to the clinical presentation of dengue and some insight as to the COVID-19 and why we need to be very careful as it relates to the vector-borne diseases, because a co-infection can very well result in a more severe form of the illness. I'm going to hand you over to the rest of the panel to continue the discussion on vector-borne diseases and its prevention. Thank you.
Thank you. Thank you so much, Dr. Joseph, for definitely providing us with some insight on the correlation between dengue and COVID-19. Thank you.
You're welcome.
Of course, in order for us to actually reduce on the vector-borne illnesses, one of the things persons would have to do is controlling vectors. And right now we have with us the Environmental Health Officer for Vector Control, Charletta Charles, will provide us with some information.
Okay, so thank you very much. In reference to vector control and controlling mosquitoes and mosquito-borne diseases, I think that one of the most important things that we should do as a nation is the control of the mosquito. Without the mosquito, you would not have the circulation of any mosquito-borne disease, whether it be dengue fever, chikungunya, Zika, or even other vectors like leptospirosis, where we normally see increased cases during the rainy season. In keeping with the theme of this year's Vector Awareness Week, and that is our actions, our community, and our health, it pretty much ties in terms of what it is that we need people to do as far as vector control is concerned. Okay, so for years the Ministry of Health, we've been talking about mosquitoes and the spread of dengue fever. This year we are continuing our initial plans of Vector Awareness Week, but just a little background. Vector Awareness Week initially started back in 2013 in an attempt to raise awareness of vector-borne diseases, because the ministry normally recognizes increases in the number of vector-borne diseases as the rainy season progresses. So we would tend to see these increases island-wide, and that is because we tend to see a proliferation or an increase in vector populations. So for instance, as the rainy season continues, there are a lot of containers, drums, discarded home appliances, even garbage, that when the rain falls, it collects water, and we see that it creates a potential and active breeding sites for mosquitoes. So in recent weeks, we've been receiving a number of calls from the Department of Environmental Health from members of the public saying, can you come around my community? We have a lot of mosquitoes, we need the spraying done. So the spraying or the fogging, which is normally asked for by the public, it doesn't really tackle the problem at its source. So the things that we try to keep the public abreast on in terms of small things that you can do around your home: check your drums, your containers. Are they properly covered? Do they have water in it? Is it properly covered? Do I need that water? Is it necessary that I store and collect that water? So these are the things that we want people to think of. Other mosquito breeding sites that are normally found in communities and around homes are flower pots. So instead of using water to fill in your flower pot, we suggest persons just use dirt, old tires, especially around tire shops or persons who have vehicles at home. They tend to have these tires. Rain falls, it collects waters, and it breeds mosquitoes. So in most instances, if you see mosquitoes in and around your home, that means that the breeding is in and around your home. Mosquitoes have a very short flight range, so they would fly about 150 yards around, or 150 yards around your house. So the mosquito will not leave Cash Trees and go down to Viewfort unless it probably hitches a ride on a bus. So chances are, when you see mosquitoes around your home, it may not be necessarily in your yard, but it may be in the yard of your neighbor. Okay, so we encourage persons to just take 5 minutes, walk around your home, look for active and potential mosquito breeding sites. If you don't know what a mosquito looks like, it looks like a tiny worm and it wiggles in the water. This is what you call a mosquito larvae. When you empty out your containers, if it's breeding, you need to watch the size of your containers to dislodge the eggs of the mosquito, so that when you refill that container, you don't have that level of breeding. Some of the other things that we tend to forget within our communities is our roof guttering. It's up there, it's out of sight, out of mind, and most persons tend not to even remember the roof guttering can collect water and breed mosquitoes. Another issue that we've seen recently out in our communities is that of defective septic tanks, or somebody might have started building their home. The septic tank hasn't been properly covered, and they start using that toilet, they start using that septic tank. It collects water because this is essentially what it does. It's a site where water is collected. That could be breeding mosquitoes as well. It may not necessarily be the Aedes aegypti mosquito, which has the potential to spread disease. However, mosquitoes are pests. Right? They're a nuisance. When they bite us, we tend to have that itchy feeling in our skin. And for some of us who have very sensitive skin, it really is a nuisance for us, and it can go just beyond being a nuisance. It can maybe cause secondary skin infections because you're scratching, you have an open wound. It now increases your risk of an infection in your skin and so forth. So we want persons to be mindful of that. In addition to that, we have issues with pit toilets in our communities. I know not everybody is fortunate to have flushing toilet facilities in their homes, and maybe because of the area or the location that your pit toilet is in, it could collect water, and that can create a big breeding site. So these are major issues as far as mosquitoes are concerned. But we're not just concerned about mosquitoes in terms of vector awareness week, because it doesn't say mosquito awareness, it's vector awareness. We also have issues with leptospirosis. For last year, we did see an increase, we saw that spike in the number of leptospirosis cases that we saw around. And we know there are a number of environmental factors which has contributed to both the leptospirosis and mosquito-borne disease. So we want to implore the public to take all necessary precautions. Cover your drums, cover your containers. Only put your garbage out on the collection dates, because this may encourage rats in and around your home. Even if the clutter, we ask you to take care of these things around your home, because this may not, sometimes we don't see how it directly affects us, but it may affect not just you, but your family, your neighborhood on a whole.
Thank you so much. Thank you, Ms. Charles, for providing us with this information as it relates to preventing breeding sites for mosquitoes. One of the things you mentioned is garbage collection and also waste. And we're happy that we actually have the Information and Communications Manager from the St. Lucia Solid Waste Management Authority, who will actually speak on the collaboration with the Environmental Health Division.
Okay, thank you and good morning to all. I would like to express sincere thanks and gratitude to the Ministry of Health for once again inviting the St. Lucia Solid Waste Management Authority to collaborate with the ministry on its efforts. particularly this one, which is Vector Awareness Week. This is not the first for us as an organization. We've always collaborated with the Ministry of Health with respect to that particular initiative. Even in terms of collaboration with the Ministry of Health, we at the authority believe that is very important, as the quality of waste management on island would impact health. If we have poor waste management on island, then we have negative impacts associated with that. Good waste management, positive impacts. And it is important that this collaboration grows and we build a relationship and keep growing that relationship. Some of our efforts are not only based around Vector Awareness Week. For example, we've undertaken derelict vehicle removal exercises together with specifically the Environmental Health Department, major cleanup exercises, as well as education and awareness campaigns. And I see this one this morning as an opportunity to basically encourage the public to do the correct thing, educating the public, and of course building the awareness required if our people are to move towards changing the behaviors required in order for us to reduce the proliferation of vectors on our island. I want to speak to two issues, specifically littering. It remains a major problem on island, as well as indiscriminate dumping. And very often, sometimes persons involved in these activities don't understand the impacts associated with it. Littering and indiscriminate dumping can contribute to breeding of vectors. For instance, anything out there in the environment, our tin cans, plastic containers that have not been disposed of properly would attract rainwater. At some point, water accumulates in these. These remain in the environment, and eventually what you have is breeding of, for example, mosquitoes. This material that has been dumped indiscriminately, of course, to some extent it provides food for vectors. So that in itself attracts these vectors, and of course you have constant breeding. In addition to that, the bulk items, sometimes we see them in our waterways, our rivers, our ravines. These contribute to ponding in these waterways, especially when the flow of water is not very high. And this ponding now creates areas or breeding sites for these vectors. So from the end of the St. Lucia Solid Waste Management Authority, I would like to appeal to residents to take responsibility for the sanitary management of waste generated. Very important, we do not receive collection every day. As such, it is important that waste is properly managed from the level of homes. We encourage residents to bag and store waste in covered containers. Place waste out only on the collection day. Very important, because if waste is not placed out on the collection day, only on collection days, what we have is opportunities for breeding of vectors. And of course, utilize the bulk waste collection days. And this is the special day that is offered to every community monthly for collection of old furniture and old appliances. And I'm pleased to announce this morning that the bulk waste collection service resumes as of next month, that is August, beginning tomorrow for those communities who usually receive the collection on that day. So keep in mind, members of the public, we're going back to your original bulk waste collection day, so please ensure that those items, bulk waste items that are around the home, old furniture, old appliances, are placed out on the bulk waste collection day for your community. And of course, if these are practiced, we will all contribute to the reduction of vectors throughout our communities. Thank you.
Thank you. Thank you so much, Ms. Jean. And of course, we realize that you spoke on the importance of proper waste management. So again, we want to appeal to St. Lucians to ensure that there is proper waste management. And also, she's asking that persons stop littering and also indiscriminate dumping. Thank you. Après ça, nous avons demandé Mademoiselle Charletta Charles pour banou Timo Powell Kweyol à sous affaire de qui manière nous ça couper à sous wis pour maladie hod migraine et puis what.
OK. Merci un pile. Ça nous avons demandé Jean Saint-Lucie pour faire c'est pour couvrir mon couvrir container. Tout bail on y oli wan caillou qui s'assemble glo et que migraine ça pendant dedans nous avons demandé mon pour jeter ces bail ça et couvrir. Là dans chaque côté oli wan caillou qui ça encourager migraine pour wete la ek pona. So nous avons demandé mon yon fois par semaine just marcher oli wan caillou. Ve sa oni qui ka semble glo, ve drum la ve se vie bagay la oni oli wan kay la, ve bouteille de les zodi oni pour mettre de pour ces gens zodi a amasser oni pour ve se bay ça et tourner se bay ça pour glo pa weti di dan pour glo pa poser puisque là pour glo a poser ça kay fait maigouin venir au wan kayon. Ça va encourager wat venir au wankayo puisque là na chay zodi de les manger quoi se manger plutôt mettre dans fridge là avec semblé pour les ces gens zodi a c'est mon qui kan masser zodi a passer pour héter so nous kan demander moun pour faire cette bail ça just only wankayo avec nous voulons moun changer bon santé c'est un bail où ça fait pour quoi et qu'on pas briser pièce j'ai ministre santé vino wankayo pour dire ça bon pour faire.
Merci Achay. Et puis après ça nous avons Mademoiselle Emlyn qui a parlé de travail là il a fait ça mais puis ministère de santé pour couper à sous ces maladies ça là.
OK. Nous, comme organisation, nous travaillons et puis ministre santé pour assurer nous un environnement qui tout le monde a une bonne santé. Et pour faire ça, nous travaillons et nous continuons à travailler et ministre santé. Mais moi je voulais dire public là. Oui, nous travaillons ensemble avec ministre santé, mais nous besoin tout gens Saint-Lucie pour faire ça qui nous pour besoin fait aussi. S'il vous plaît, pas jeter zodi tout partout en pays. Moun ka jeter zodi bon chemin, moun ka jeter zodi en canal, moun ka jeter zodi en la rivière. Et ça ka potiwe Saint-Lucie on chaytoa ka. Kachile les ordi aller côté pas supposé aller. C'est ti bomb là, c'est plastique container qui se manger tout ça quand enjadoué vermine. So si nous ni pour fait assurer nous pas ni se bay ça au lion nous pas ni vermine au lion nous il est important pour moun faire ça qui supposé fait pour chen pays à net so nous commander moun pour assurer tout zodi bien mettre en sac et bien placé dans un conteneur qui couvert et zodi ça est important pour tout le monde mettre dehors jouer truck la ka passer en commune là si ça passe si ça pas fait il kay affecter nous en manière nous pas vle et ça c'est vermine nous kay joindre aussi autorité management zodi Saint-Lucie ka vie commencer collection gozodi ou savent nous tenir en service côté nous te ramasser zodi une fois par mois en chaque commune dans pays nous kay commencer ça en mois à oua so changer ou tenir un jour truck la te ka passer en commune truck la kay passer en commune même jour ça so nous ka commencer en mois ou ça c'est from demain truck la kay c'est commune là qui ka toujours joindre service ça li premier samedi en mois et nous ka quoi si tout le monde fait tout ça qui nécessaire nous kay ouais plus moins vermine en pays.
Merci Chari, merci. À nous changer qui c'est commune nous, c'est action nous, exercer nous. À nous faire ça qui est nécessaire pour couper à sous des maladies comme dengue et leptospirosis. À nous toutes jouer un pas. Before we close, perhaps Dr. Francois or Dr. Joseph can give us a final message for the public.
Okay. Thank you again, Ms. Neptune. For the general public, in addition to what has been said, we urge persons to take a personal responsibility in helping control vectors in St. Lucia. It is our responsibility. It is not the responsibility of Ministry of Health or any other ministry, but persons need to be each other's keepers. And if you notice your neighbor or your companion doing something that you know is wrong, we urge you to have that little discussion with them. It would protect you, it would protect them, it would protect the entire public. So we're asking you to work together, work with us, and exercise your responsibility as a citizen to ensure that you do the necessary to control dengue, leptospirosis, and other vectors in St. Lucia and keep us all safe.
Thank you so much. And of course, we want to thank the panel for providing us with such valuable information today. Thank you so much.
Welcome.
Thank you.
Let us all keep in mind that this is our community, our actions, and our health. So let us all play a part in getting rid of vectors such as rats and mosquitoes to reduce vector-borne diseases. Well, that's how we come to the end of the live broadcast of the launch of Vector Awareness Week. On behalf of the entire production team, I am Fernelle Neptune. Thanks for watching.